Hey guys, I know it's been a bit with starting orientation for my new job. My schedule's kind of changed a lot, so I'm probably going to have to change the days that I put out videos since right now I'm, working Wednesday, Thursday, Friday. It makes it a little difficult for me to put videos out on Saturday morning because I don't get home until probably close to 8 o'clock, and I am not going to be filming at 8 o'clock at night after 3 12s in a row. It's just probably not going to happen, I'm not going to lie. But what I want to talk to you guys about is my very first week of orientation on the floor. I started 3 weeks ago, and that was just kind of hospital orientation, learning about some policies and procedures, and kind of getting acquainted with just things like human resources and all of the normal kind of businessy stuff you do at any type of job. Now this last week, I actually started my orientation for the department. And I was kind of in a lot of different areas. I was in Peds ER for a little bit and, helping out and seeing what I could help with in trauma and getting called down there occasionally, and CVCU or cardiovascular care unit along with the chest pain unit. I was in the ICUs helping out in adult ER as well. So just kind of, moving around to the various areas, getting accustomed with being in the hospital again as a whole, because I actually haven't done patient care for the last, I don't know, maybe 4 months or so since graduating and taking boards and all of that. So kind of re-jumping into all of that is a whole new thing. But I do want to say, I've had really good people orienting me so far and showing me kind of the ins and outs of charting, because charting's a lot. When you're a student, all you really have to worry about is, your patient assessment, chart reviews, things of that sort, and you're not ultimately responsible for that patient. You've got your preceptor there who's going to be watching you like a hawk to make sure everything's going okay. But as a respiratory care practitioner, being on the floor and learning how to work at your new job, they're not there to teach you how to be a respiratory therapist. You are there to learn, the equipment that they use, things of that sort. So they're not going to be watching you like they would as a student. So it's a whole different level of anxiety that you have, or, stress that you have from going to clinicals to going to being a full-fledged respiratory therapist. Because at this point, not only are you dealing with, patient assessment, vent checks, emergency situations that might come up, charting, and there is a lot of charting, phone calls, juggling multiple things at once, and you are the primary person responsible for this patient. Although you do have the person that's there orienting you to help, how my orientation is primarily working is they're expecting me to hit the floor running. Now, there are difficulties because I am a new grad and I'm fully aware that I don't know everything yet. And it's been a little while, like I mentioned before, since I've done patient care because of being out of clinical for a little while. And I think even when I was in clinical, my clinicals, I didn't do them throughout the whole semester. I would have, gosh, I've already forgotten, I think like 10 weeks of class and then 7 weeks of clinical and then go back to 10 weeks of class. So there was usually a pretty decent gap. So the first week was always kind of a little shaky for me, even in clinical, just getting reaccustomed to being in the hospital and working with patients and kind of getting that flow down. So the same thing was true of my first week on my new job, just getting reaccustomed to everything. And then there were a couple of things that I'll say, kind of affected my performance. Of course, I was nervous, and I'm one of those people, when I'm nervous, I don't sleep well and I don't eat well. And when you're not sleeping well, nor are you eating well, you're gonna be tired and hungry. So it's gonna kind of, slow you down mentally a little bit. Maybe, you're not functioning at the level you normally do. As well as, I had experienced charting from my clinical days, but usually it'd be, on a patient here or there, not every single patient, while juggling multiple other things. So finding that time management and getting it into place, I think, especially with charting and the various other little responsibilities that you get as, a respiratory therapist versus student, that's going to be the biggest challenge for me. And I did notice that because I was So new to charting, I was focusing way too much on it last week. I was so nervous about, oh, am I charging for the right things? Am I charting at the right amount of time or like within the right time frame, that I was not, I was not paying attention to other things like I should have been. I was just way too concerned with charting, because also each person that you orient with, I will not orient with the same person every time I go. Each floor it's going to be a different respiratory care practitioner that I'll be with. Everyone has their own way of doing things, and that's awesome because you learn a lot of things that maybe you hadn't thought of before, but sometimes the way that someone else does something might not be the most beneficial for you. I was kind of trying to implement what the people orienting me those days would do, and sometimes that just didn't work for me. So what I'm going to do next week to make next week a little bit smoother and kind of find my own groove is, first and foremost, I'm going to make sure when I get home I decompress and go to sleep. Sleep was probably the biggest factor for me because I think I was sleeping maybe 3 to 4 hours a night, because I would come home, I'd be studying, I'd be doing this and that and trying to figure things out, but then I'd wake up the next morning, I'd just be exhausted and moving kind of like a turtle in peanut butter, and that's not good when you're supposed to be, the primary person. So first and foremost, sleep. And when I go to the grocery store this week, I'm going to make sure that I get lots of things that my body wants to eat that are nutritional, because if you are not sleeping and you're eating a bunch of junk, that is also going to kind of affect the way that your brain works. And these are all things I knew from clinical before, but like I said, it's been a little while since I've, done patient care and been back in the hospital. So sometimes we kind of have to remind ourselves of these things and relearn some of these things. And then finally, of course, I'm always open to criticism and tips. If I'm doing something slow and someone sees how I'm doing it and they suggest like, hey, try doing it this way, I try to pick that up. But there are a few things that I used to do that worked for me a little bit better, and I think I'm gonna, go back to that and try to re-implement those things to get my own personal flow and style going to make it more consistent and just make things easier overall. So something, that I do want to say, especially for those of you that are, also starting with me. I know there's a ton of you guys that graduated at the same time as me and are starting your first jobs also, or are looking for your first jobs. If you feel, kind of shaky or a little bit unsure your first week back out, just remember that's normal. We all felt that way in our first clinical, and although you have more responsibilities now, you're probably going to feel that same thing going into your first job. And that's okay. It's the same thing as anything else. The more you do it, the more accustomed you're going to get to it, and it just kind of takes some time to find your own balance and what works for you. But always be open to criticism, always be open, constructive criticism, and always be open to learning new things and, asking people if they need help or what they think of something. Because let me tell you what, there were multiple things that I was asking about because I was curious and I wanted to make sure I was doing something right, or maybe there was a particular event that I was like, oh, I can't remember how to get to this specific section in the event. It's better to ask than to sit there and struggle and, have an issue with something. So again, just keep going, everything will work out, and I'll keep updating you guys as I go. Like I said, I'm probably not going to be able to do Saturday mornings anymore because I'll be sleeping Saturday mornings. But if you guys have any questions or want to share some stories of your, first weeks or days at your new job as a new grad, leave them down below. And again, don't forget to follow me on Instagram. I'm going to be doing a lot more of the study with me, maybe start doing a Medical Monday type of thing where in my stories I'll kind of post different pieces of information regarding disease process or maybe equipment, something of the sort. I'm going to try to be a little bit more consistent than I have been now that I'm getting a little bit more acclimated to my new schedule. But as always, thanks for watching, guys, and I'll see you next time.